Kia ora everyone. We're seeing lots of feedback and questions coming through on social media about COVID-19. And there's been lots of research and evidence out there, including this report from the World Health Organization about specifically COVID-19, but no one expects you to read that. So today, to help us share a little bit of information, facts and tips around managing COVID-19 for you and your family, and also for New Zealand, I have the Chief Science Advisor, Juliet Gerard, and also Michelle Dickinson, also well known as Nano Girl. And both of them are going to help me answer some questions I've been seeing from you. So the first question I thought I'd ask is basically, what is COVID-19 and how is it different, for instance, to the flu that we see in New Zealand during flu season?
So I'll start with that. COVID-19 is a virus. It's part of a coronavirus family, and there are lots of viruses out there that can make us sick. This is a form, and we call it a novel virus because this is sort of the first time we've seen it in this form. And the challenge with viruses is they're invisible to us, so it can make them very scary. But what's really great is we've been able to do a lot of research understanding how this virus differs from the other, and we're now learning about it and hopefully able to talk about it.
I know as well that lots of people are getting questions around how to explain what this is to children, because they'll be hearing and seeing some of the discussion. Probably it might seem a little frightening to kids. Any tips on how to have that conversation with children?
Well, I've been doing a lot of work with parents and children. I've brought my little test virus here. So the easiest way to explain it to children is that viruses are basically a tiny ball. And so you imagine that this little soft toy here is a tiny ball. And sticking out of the virus are these little dangly bits. And these dangly bits are what the virus uses to attach to us. And depending on the dangly bit, depends on where in our body it attaches to us. Now, what's great is that viruses don't have legs and they don't have wings. So they just stay there and they need us to actually get them to infect us. So we need to stop helping them. So the easiest way to explain it is if your child has had the common cold, for example, they would have had a virus that had a dangly bit that attaches to our nose. And it would have stuck to our nose and made them sick. They'd had a stuffy nose, runny nose. The COVID-19 we're talking about, it has a different dangly bit and it attaches to our lungs. And so the difference between the common cold and some of the other viruses is the dangly bit and where it attaches to. And that's what gives us the different symptoms. And so the best thing to do is let the virus stay there, keep our hands clean so that we're not touching it. And if we are touching it, we're washing it off and trying not to touch our face because that's how the virus gets to the place that it needs to go.
And so that really helps with that message around transmission. So then tell me a little bit more about some of the tips, because people will probably hear public health officials saying wash your hands and think that feels like really trivial advice. But why is that message one of the most important ones?
So one of the differences between coronavirus and flu is not just the dangly bits, but there's like an envelope around the coronavirus. And that's lucky in this case because it makes it quite easy to kill. So when you wash your hands, you're not just washing it off, you're also bursting that envelope and killing the virus. So any soap, any hand sanitizer, any detergent, any bleach will burst the envelope and actually kill the virus.
And a lot of people really are heading towards a hand sanitizer. Is there any reason why that is better or worse than just plain soap and washing your hands?
Just wash your hands. So if you can't find a sink and soap and water, use some hand sanitizer if there is some. And whatever you do, don't touch your face afterwards.
The touching the face message I'm hearing coming through a lot. That's actually easier said than done. So in those scenarios, I mean, I see people wearing masks. Your views on masks, because a lot of people are going out, buying up their hand sanitizer, buying masks and also toilet paper. But is there any reason why masks are something that people should be using?
So for the general public, if you don't have symptoms, there's no need to wear a mask. The thing is, the virus can still get in through your eyes. So if somebody's going to sneeze on you, the mask will only protect your nose. It won't protect your eyes. The people who will need to be wearing masks right now is if you are symptomatic, if you have symptoms, if you're sneezy, wear a mask because we know that the particles that you sneeze out could possibly infect people. So what that does is keeps those particles inside your mask. You can't reinfect yourself. And so masks are really good for that. Masks can be good because they make you aware of your face. And so they stop you touching your face. But the best thing to do is just train yourself to put your hands down and not actually touch your face. You don't need to be wearing a mask all the time unless you are symptomatic, you have symptoms. And so there's a lot of people buying them thinking they're being protected. but actually it's about having good hygiene and keeping your distance from people.
So probably good for people who are symptomatic, and probably also our health workers, I would have thought as well.
Yeah, so they're a special case because they're getting exposed to lots of viral loads, not just coronavirus, but all the other viruses. So that's why they'll be wearing them.
And that's why we have 9 million as part of New Zealand's pandemic plan at the ready, particularly for those health workers.
There are different types of masks. So the ones that people are buying at the supermarket are what are called surgical masks. They're the rectangular ones, and you'll see that they've got gaps in the back here, so they're not fully protecting you. The ones that our healthcare workers have are different, and they'll have a full seal around their face. Those are very important for our healthcare workers, and we need to make sure that there are enough for them.
And thankfully, we've got them all stocked away as part of our pandemic plan, and they're ready for distribution to our healthcare workers. Tell me about surfaces, because lots of chat about surfaces as well, and whether or not, can you pick it up from just any surface at any given time?
Yeah, so that's one thing that we need to really start thinking about. So if you think about a sneeze or just breathing or coughing, occasionally people are going to spray droplets on surfaces. And it turns out this virus can live for a few hours, if you're really unlucky, a few days on surfaces. So we just need to keep everything extra clean.
That's why, actually, I guess it still needs to get to you, doesn't it? So just washing your hands is, again...
And think about what you've touched.
Yep.
And also, if you are sick, making sure you control your sneeze, because you're the one leaving the virus there. So we say if you are going to sneeze, have a tissue handy. If you do, sneeze into the tissue and then throw the tissue away. Or into your elbow. So sneeze into your elbow like this, because you're probably not going to wipe the inside of your elbow many things. You see a lot of people, I saw it today, they sneeze into their hands, you've now got the virus on your hands, and then you touch surfaces and you leave it there. So we have to be responsible around how we sneeze.
Catch a cold.
And that's why self-isolation works.
Yeah.
Because nobody's there to touch the surfaces and catch the droplets.
Yeah, can we talk a little bit about that? Because you'll hear when people are found to maybe have tested positive with COVID and they may have been on a plane. Does that mean their whole entire plane needs to worry?
No, that's where people are getting unduly worried, I think. So it's spread in droplets and surfaces. So if you were really unlucky and you walked down the plane and touched a surface, maybe that's what they call a casual contact. So there'd be a really low chance of getting it. But the people we're worried about are in close contact like we are. So if I can smell what Michelle had for dinner last night, I'm probably a bit too close.
Yeah,
Hold on.
No,
we're good.
Yeah, you're good. Because actually we're talking public health, they're talking 1.5 metres, and even then that's close enough that if you cough, you spit on me. That's basically what
I won't spit on you today, but yes, if I could, that's too close.
So that's the parameters we're dealing with here.
That's how that's eating things done.
So it's not like measles, which can actually linger in the air.
Yeah, so if someone had measles on the plane, you'd be much more worried because it could spread in the air.
Yeah.
But we also have to remember that aeroplanes are one of the best filtration air conditioning systems in the world. So people have said, well, it's going to get into the air and it's all circulated, but actually there's great filtration there in modern planes to be able to actually filter some of these particles out, including viruses and bacteria.
Still requires to spread through that droplet as well, doesn't it?
Yeah.
So tell me a little bit about why self-isolation has been so important. We, of course, have required anyone who's a citizen who's coming home from, for instance, mainland China, northern Italy, Iran, South Korea, to self-isolate. We've had over 8,000 people doing that, and people have been really questioning whether or not it's actually a useful tool. Tell me a little about your views on self-isolation and why it's important.
I think it's the single most useful thing because we don't have the vaccine yet. That's probably more than a year away. People are working incredibly hard, but that's just how long they take to make. We don't have specific drugs, so all we can do is keep apart from people so we don't spread it. We understand in a really detailed way how it spreads, so if people stay apart from one another, they can't pass it on.
Yeah. And is there any research around whether or not people, if they're told to self-isolate, actually will? Because I know there's a lot of questions about that.
I was talking to the people in the Ministry of Health the other day, and they were saying it's a very small percentage of people that actually refuse to do it.
Yeah.
Most people are really happy to do it because they understand it's protecting other people in the community who might be more vulnerable. So most people who are in self-isolation are feeling absolutely fine or are just there as a precaution, but we're worried about people saying rest homes where they might have pre-existing conditions and it might affect them more badly.
This is where New Zealand really gets to pull together and be a team, because if you do know somebody, and part of it is just a lack of understanding of why self-isolation is important and why we need to do it for New Zealand. You might feel fine, but if you are carrying the virus and you have a tiny symptom, you'd be like, oh, this is a little cough, it's not coronavirus. if it was, you are putting many other New Zealanders at risk, especially those who are vulnerable. And so self-isolation is maybe not about protecting you. Yes, it's going to be inconvenience. It's about protecting our population.
So all the things we're doing in New Zealand are to slow it down. We won't stop it, but as soon as we find people, if they self-isolate, that's the single best thing we can do to slow it down.
Which is exactly why we track and trace people who have had contact, and we ask them to self-isolate. Tell me a little bit about then, if someone does have COVID-19, tell me a little bit about what they might experience.
Yeah, it depends who they are. So according to the report in China, about half the people didn't really have many symptoms at all. And the good news is those people don't seem to have passed it on. It's really unlikely if people haven't got symptoms that they pass it on. Then there's a group of people that just, it feels like a really bad cough. So they're sick, or maybe some of them aren't even sick enough to think they should stay off work, but they should stay off work now because it's so catching. And then there's that smaller group, and it depends which figures you look at and whereabouts in China you were, that were quite serious. And some of those had to go to hospital. And then there's a small group, low percent, that end up in intensive care, and they tend to be older people with pre-existing conditions.
Yeah.
But the good news is that children don't seem to be impacted too much, so they've got the lowest rates.
Tell me a little bit about children and young people, because we haven't seen a lot of reporting on that, and I know there's a lot of questions from parents in New Zealand. So what is the transmission rate for kids, and why is it so low relative to others?
It's one of the great things about science is we don't know. So as a scientist, we're fascinating in this. Look, the belief is right now it's something to do with the immune system. We do know that children are very exposed to coronaviruses like the flu in schools, and so they could maybe have something in their immune system that means that it can cross-protect them, maybe. We don't fully understand it, but what we have seen is those children who do get the disease are typically asymptomatic or have very, very low symptoms. They're not having severe cases, but we have to remember that means they can still carry and pass it on to their grandparents, which is the bigger issue. So we don't fully understand it, but we have seen other diseases such as chickenpox, for example, where if an adult gets it, it's much more severe in its case than it is if a child can get it. And so scientists are looking into why that might be.
Why is it important, though, that we keep an eye on what we're doing with schools and education?
Well, that's a really obvious thing that people jump to. Should I send my kids to school? Again, in the report, the transmission rate between children and from children to adults seems really unusually low. We can't rule it out, but it seems, unlike, say, measles, this is something that is a safer disease for kids. But obviously, if we had a few cases in a school, there's teachers, there's cleaners, there's other people to worry about, and there's that low risk that they'll transmit, so then people might start thinking about shutting them. But while we're in a stage where we've just got tight containment, we know who the families are, all the chances are really low. You're much more likely to get a different disease than coronavirus at the moment in schools.
But if your child is showing any symptoms of being sick with anything, just keep them
at
home,
home,
which is what we should be doing anyway, especially with children where the symptoms are less. So people have heard, oh, well, when you get pneumonia, that's when it's got you. But actually, just a slight cough could be something as the symptom for a child. So we have to make sure that if your child is looking a little bit under the weather, showing some symptoms of any illness, let's keep everybody safe and actually call your health provider and say, this is what I'm seeing, what do you think we should do? But we shouldn't be keeping all children at home right now.
In Japan, they've found that people doing all the hand washing has reduced the flu rate,
Yes.
which is fantastic because that means the doctors are more available to treat the COVID-19 patients.
Which is actually a really good point. Most of these, actually all of these tips are just good practice, particularly as we come into flu season.
Keep healthy in winter.
Keep healthy, wash your hands, dry your hands, and stay home if you're sick. One of the things that's being brought up a lot on social media are, for instance, why New Zealand wouldn't just shut the border entirely. Look, this is probably something that I have to answer as well, but if either of you have a view on that.
There's a big debate about that. So some people think shut the border is a great thing to do. Other places, like the UK, have said, look, all we do when we shut the border is delay what happens. And so they haven't bothered. They've just wanted to deal with it as it comes. In our case, we have some particular concerns around being a gateway to the Pacific. And so the more time we could buy for ourselves and the Pacific to get prepared, the better. But it's going to come in, we can't shut the border forever.
I think it's also an important point to make that actually all of the cases that we've had so far have actually been citizens or residents of New Zealand, and so they've been people who live here. So I think that's an important point too.
We have to let people come home.
People have to be able to come
home.
And
I've also seen people say, well, why don't we test everybody who comes in? The challenge is that not everybody shows a fever initially, and they could just be incubating it for a few days. So we can't just test everybody and be like, well, that's how we're going to catch them all, because the people who would have come in would likely not have had a fever fever when they arrived in New Zealand would have passed the test, and then maybe that even gives them more
false sense of security,
Exactly.
and they may not self-isolate.
And
I've
think of all
also
the useful things you could do with those people.
those health
Yeah.
workers instead of testing everyone unnecessarily. The other question, of course, I see at some airports, temperature tests, same rationale. So if we temperature test everyone, they may think they're absolutely fine, but maybe some
And who knows
symptoms
what's
later.
happening inside. Yeah.
So those are just some of the, and they're really understandable questions, but I think worth covering them off. If someone does find themselves symptomatic, should they go to the GP?
Not straight away. Call your health provider. Look, GPs and our hospitals are prepared for this now, and so if you call ahead, it allows everybody to stay safe, and they can isolate you and bring you in maybe in a different door, and make sure that PPE or protective equipment is worn by the professionals so that they can protect themselves before they meet you. So don't just turn up.
Yeah.
People in your doctor's office are probably with a compromised immune system and already have a pre-existing condition, so it would be very dangerous for them to be exposed to you. So this is again about New Zealand pulling together and making sure we protect everybody. Call ahead.
One of the reasons I referred to the first case we had as textbook was because the person did just that. They called Healthline before going into the hospital. It meant that everyone received them exactly as they should, and managed to keep the person isolated, all the PPE gear worn, and so it was exactly as it should be. Are there any things that you think that people have been asking both of you that you think we should share?
I think the big thing that isn't being talked about right now about the media is the great recovery rate for
Yeah.
this. And so it's actually, although it sounds very scary and it's a virus, we're not talking about the fact that most people will recover. And so we don't talk about the fact that this actually is a disease for most healthy adults and for children that is easy to recover from if we take good precautions and we look after ourselves and we keep hydrated and we contact the health professionals when we need to. It's actually got a great outcome.
In fact, so far of the cases that we've had in New Zealand, only one has been in hospital, and that was someone who unfortunately was in a more vulnerable position. So I think that does prove that point.
I guess the other thing people say is, it's no worse than the flu. In some ways, it doesn't really matter. So it is a bit worse than a bad flu, but it's not as scary as something like SARS or Ebola. So we should deal with it in the same way as a bad flu, and all these things that we're doing will prevent bad flus also.
Well, thank you both. I think, for me, the big take-homes are actually there are plenty of things that all New Zealanders can do, and that includes just those basic practices that are actually going to keep them healthy and well through flu season as well. So just remember, wash your hands, dry your hands, and do make sure if you've got a cough or a cold or any flu-like symptoms, if you're sick, stay home. If you need to sneeze or cough, into the elbow, and trying to share those practices with children as well. If you are symptomatic and need to go to the doctor, please call ahead. Just give them the opportunity to prepare for you popping in, just in case. And of course, to our clinicians, we have the ability to test up to 550 tests a day for COVID-19. So we have the facility and the resources, and they're all available, and we'll be asking them just to follow what they believe is in the best interest of their patient. If they need to test. If you have any more questions or thoughts or concerns, feel free to keep posting them. We'll do our best to keep putting out as much information as possible. Till then, thank you, Juliet, and thank you, Michelle, for joining me today.